Hello, my name's Nathan. I'm a level 1 student here, and I was wondering if I can ask you some questions and follow your patient.
Hey Nate, what can I help you with?
Yeah, can you give me a handoff on this patient, a report?
Yeah, right here we have Mr. Levi Restevo. He's in room 620. He's a patient of Dr. Phillips. He's a 67-year-old male. He came to us because from the ER because he was having hyperglycemia. The paramedics brought him in from his doctor's office. Apparently he's been unable to control his blood sugar for the last 5 days. When they brought him in, his blood sugar was elevated. They were treating him in the ER, and we're going to continue treatment on the floor here. Because he's been unable to manage his diabetes properly, he's got a wound on his right heel. He was found to have an A1C of 8.2%, which is going to mean that he's got uncontrolled diabetes over the last 90 days. He's a full code. He's allergic to tetracycline, peanuts, and dog hair. He was also complaining to me earlier about some tingling in his lower extremities, which is going to be consistent with that diabetic neuropathy. So we're going to need to monitor that. He hasn't had any adverse breathing problems. He denies any cough, dyspnea, shortness of breath, chest pain, or any tightness. His lung sounds heart sounds were all within normal limits. For his diet, we've got him on an 1,800 calorie diet, and he's limited to 2 grams of sodium because of his diabetes. For intakes and outputs, he ingested 320 milliliters, and he output at 320 milliliters as well. So he's been, moving his fluid pretty normally. To his right heel, we've gone ahead, we're placing a dry dressing on it while we're waiting for a wound care consult. As we get into consults, he's got a consult for PT, case management, he's got a wound care consult. They were supposed to have been here at 4:45, but I haven't seen them yet. So we're going to contact and find out where they are. As far as his vital signs, he's been running a little febrile, and we think that might be due to his wound ulcer. Last temperature for me at 4:45 was 100.1. So it's come down a little bit. His temperature was 101.4 earlier. Last blood pressure was 132/70. He had a heart rate of 76, and he sat 96% on room air. We have 3 medications to give today, and we have to hang his maintenance saline. We're going to go ahead and give him his insulin for the sliding scale. And we did a blood sugar check on him earlier at 4:45, and that came back at 290. We also have his vancomycin to hang. That's going to hang, it's a 250 ml. He's getting 1,500 milligrams, and that needs to be infused over 2 hours. And his lisinopril we're going to give, and he's getting 10 milligrams PO. Like I said, his last blood sugar was 290. We've gone ahead and looked at his other lab values. His white blood cell counts were elevated, which is probably why he's getting the antibiotic. His hemoglobin was a little low, so he's a little anemic. We're going to watch that a little bit closer. Yeah.
Okay.
Any other questions?
Does he have any IVs or anything?
Yeah, he does. He has an IV in the right in the right forearm. He's got a number 20 in there.
Oh, okay, okay. Why specifically is this client receiving those 3 medications?
Well, for the first one, he's getting the saline we're going to give him is the maintenance infusion. He's getting at 30 milliliters an hour. We're giving that to him to help support hydration, to make sure he doesn't become dehydrated. He's getting the vancomycin due to the elevated white blood cell count. That the antibiotic is going to be given for, it helps break up the cell walls and allow us to fight off the bacteria with the vancomycin. The lisinopril he's receiving, normally we give that for a blood pressure. He doesn't have a history of hypertension. He was a little hypertensive when he first came in, but we're actually giving it to him because of his diabetic neuropathy. It'll help improve the symptoms of his diabetic neuropathy. The insulin, obviously he's here because he's an uncontrolled diabetic, so we're trying to get his blood sugar under control with some regular insulin. So we're looking to bring that down from the 290, and we're trying to bring that within the normal range. So, and we'll be giving that right before dinner so that we can cover him before dinner.
How long do you usually give it before dinner?
He needs to eat within 30 minutes.
Let's see. When would you question administering any of those medications?
So to start with the insulin, because it's a rapid acting insulin, we want to be careful giving it if he were to be hypoglycemic or he was unable to eat. So if he was nauseous, couldn't eat, vomiting, or he was NPO, we wouldn't want to give it. As well as if his blood sugar was below 160, we wouldn't want to give that either. The vancomycin, he doesn't have any adverse reactions to the vanco or penicillins, so we can give it to him. Vancomycin, if we have a history of adverse reactions to penicillins or vancomycin, we wouldn't want to give that as well. The lisinopril, we're going to want to monitor his blood pressure on that. We also need to monitor his respiratory status. So if he's hypotensive, if he's hypoxic, having shortness of breath, we wouldn't want to give that either.
Oh, okay. I was actually just going to ask about the vital signs, but you just mentioned them all. What would you teach the patient to make sure that he's taking them at home, properly?
So more than likely, Mr. Restivo is going to be on insulin when he leaves here. So we're gonna educate him a little bit about the insulin, about monitoring his blood sugar, making sure that he can do that. He probably will not be on the vanco, so there isn't much training that we're going to need to give him on this. He'll probably be, if he's still on an antibiotic, he'll be on some form of an oral antibiotic. The lisinopril, if he maintains on the lisinopril, we're going to need to teach him signs and symptoms of adverse effects of lisinopril if he were to have itching, hives, rash, or a chronic cough that he can't shake. And the normal saline, he won't be continuing at home.
Okay. What are some side effects and adverse reactions that you can have with some of these meds?
Well, the lisinopril, you can have a bad allergic reaction to it. He's been on it before, but we need to continue to monitor him for it. He can also have a dry cough that can start from any ACE inhibitor. The vancomycin, he can get what we call red man syndrome, which is where he's going to become really flushed. He can also have an allergic reaction. He can have clotting edema on pretty much any of these medicines if he's never had them before. Yeah. The insulin, we can have hypoglycemia as well.
Okay. How would you know that the medication that you're giving is effective?
The insulin, we're going to be looking for a decrease in the blood sugar to bring it within a normal range. That's why we're going to recheck the blood sugar at 2 hours. The vancomycin, we're going to be monitoring his white blood cell counts and his temperature to see that we're getting the infection under control. And the lisinopril, we're looking to see some relief of his tingling in his feet. And the saline will maintain him to be properly hydrated.
Okay. Thank you for that. I'll just kind of watch you give some meds, if that's okay.
All right, perfect. Come in the room, clean our hands as we're walking in the room. Hi, what's your name?
Levi Restivo.
Hi, Levi. My name is Matt. I'm going to be your nurse. Can you tell me your last name?
Restivo,
And how old are you?
67.
All right, good. Are you allergic to anything? We're just checking the name band here and checking his allergies.
Yes, I'm allergic to tetracycline, dog hair, and peanuts.
All right. And what happens when you have those?
They give me a rash.
All right. I apologize about the cameraman here. We're shooting a reality TV show. So let's just pull up your chart here, see what all we got going on here.
Sounds good.
All right, so I have Levi Restivo, and you were 67, correct?
Yes.
All And you are allergic to tetracycline, dog hair, and peanuts, right?
Yes.
Alright. I'm just going to look at your orders here. And today I have ordered for you vancomycin, lisinopril, regular insulin, and we're going to hang some fluid.
Okay.
Have you had all those before?
Yes.
Alright, we have all those ordered. Alright. And we've checked, and all 4 of those are coming up to you. So, Mr. Recibo, first thing I'm going to do is I'm going to check your IV, make sure that it's functioning okay.
Okay.
How's it been feeling? Has it been hurting at all or anything?
No, it's fine.
Alright. So we got it clamped here. Clamp it. Scrub that hub for 15 seconds and then we'll flush it. The flush is good and we're making sure that it's not swollen or anything. How's it feel? Does it hurt at all?
Nope, feels good.
Alright, good. Mr. Steva, can you do me a favor? We're on budget cuts and we don't have scanners. Can you read me the identification number off it? It's going to be this number. There. Twist your wrist like that.
You want the MRN number? Or
Yeah.
that one?
Barcode.
686-764-5607.
And we have Levi Restivo.
Yes.
We're going to confirm your medication here.
What does that green light mean?
The green light means that we can go ahead and administer it, that we've confirmed the order with the, against the MAR. And we have the correct patient, the right medication that's going to be given at the right time. So we're going to go ahead and get this set up to infuse. The first thing we're going to need to do here is we're going to need to spike the bag, so we're going to want to keep this so it doesn't get tangled. We're going to need to close the roller clamp. Now once we open this, we want to make sure we don't touch the inside with the sterile tip, so we're going to keep everything covered to keep everything nice and sterile. Alright, we put a little bit of fluid in the chamber, and then we'll go ahead and into a trash can. So we don't get it all over the floor. The janitors don't like that here.
Now I know you guys don't have any pumps because you're on budget cuts and this hospital's in the inner city. How do we give it to the patient on the right
That's
route?
a very good question. We actually have something called a dial-a-flow here. You can use this with antibiotics. They don't allow you to use these with certain medications, but none of which Mr. Restivo is receiving. So with the dial-a-flow here, we're going to want to go ahead and take the caps off and then reconnect. Again, we want to keep it nice and clean and sterile. we'll go ahead and we'll open this to flush. And we'll let this flush through. Alright, we want to make sure we get most of the air out of the line, especially through the part if we had a pump, but we don't have pumps, so we don't have to worry about that. And we're going to set this to 30 mLs. Now I know I just cleaned this, but we got to do it again because I know you don't like to take a bath. You were just in the hospital last week, weren't you? I've seen you quite often here. You get your diabetes under control. Alright, good. Go ahead and open that and make sure you get a couple drips. There you go. So we're going to go ahead and date this. This tells us what time we put this on. Date and initial. This is for the tubing because the tubing is only good for so long for hospital policy. And we're going to go ahead and document this. Documenting it's in the right forearm. We're giving this at 1700.
How many mLs an hour did you give it?
I think he's getting at 30 mLs an hour. If we look here, let's continue infusion. Alright, since we're going and we're already playing with the IV, we're going to go ahead and tame his vancomycin. So, again, we're going to confirm the order. We've already confirmed the order. We're looking at the MAR, looking at the medication here. We've got the expiration date. It's October 2018, and it's ordered for 1,500 milligrams over 250 mLs over 2 hours. Again, if we hover over it, we can see. Mr. Restivo, can you repeat your ID for me?
Sure, it's 686 764 5607.
Alright, we have Restivo Levi, and we'll put in this long medication number. Alright, we got the green light, means that we're okay to give this medication. Alright, so again, we've confirmed the order, we've confirmed the time. We know that Levi's not allergic to anything. We've gone ahead, confirmed it's the right patient, right route, right time. It's going to be given through IV. We've contacted the pharmacy for this medication. There is no reason to change it. This is exactly how they want. They're actually kind of agitated that I asked them if we had to crush it.
Yeah, I heard
You're not
him.
allergic to any of this, right?
No.
No, okay. So because this is going to be a secondary infusion, We need to go ahead and hang the primary tubing a little bit lower. This will be so gravity will allow the medication to go in and it won't backflow. Shut the IV line down. Alright. Same thing as the other one, this is just a little bit shorter. We've got caps here. And we want to keep everything nice and clean. Alright. We'll allow this drain a little. There we go. Alright. Screw this on for 15 seconds. We have to save our caps here at St. Pete Hospital. Alright, so now on this, we're given 250 mLs, and we're giving it over 2 hours, so it's going to be given at 125 mLs an hour. Right?
Mm-hmm.
And then we can go ahead and open up. Verify that it infuses.
There we go.
Alright. Again, for this one, use another tube. We need to date the tube now. Tubing's dated. Alright, and we've got all the information documented. We've documented the location, and documented that the IV is being. Camera angle's kind of crazy here. Alright, we're going to go ahead and give his insulin now.
Okay.
We checked his insulin at 445, so about 15 minutes ago. His blood sugar came back at 290. He's on a sliding scale insulin. And if we hover over it, we can see at the 290, he's going to need 16 units of insulin to cover his blood sugar. Mr. Stevo, have you been eating okay?
I probably haven't been eating when I should be eating.
Yeah. You'll be able to eat for me in about 30 minutes, right?
Oh, definitely.
Perfect. Healthy food, of course.
Sure.
No more than glazed donuts.
No more Hot Pockets.
No more Hot Pockets. Can you read me your number one more time, Mr. Barcode Scanner?
Sure. 686-764-5607.
Alright, your names are Stevo. First name?
Levi.
Levi. Alright, Levi. And we're going to be giving you regular insulin. We have 16 units ordered for you. So we go ahead, we'll check the clarity and the expiration date. The expiration date is March of 2019. Alright, we got the green light there, means we have the right medication, the right route, the right time. This is ordered to be given sub-Q, so we're going to need to go ahead and draw it up. Now with insulin, this is a multi-use vial, so we need to clean the top of it. We have a brand new insulin syringe here. We don't reuse needles here. I know your old facility you guys probably used to, but we don't. So we're going to go ahead and draw 16 units of air.
Yes, there you go, sir.
Alright, I just left the room, so I have to re-clean my hand.
That's good hand hygiene.
We use the Target brand hand hygiene here, nothing but the best at SPC Hospital. Their glove holder doesn't work. Really good gloves here, too.
So what was wrong with that insulin needle? It was just bad?
No, the insulin needle was retracting. Alright. And alright, so now we will draw 16 units of air. You want to push that needle all the way in. Or retract. 16 units of medication. Now, we don't recap normally on dirty needles, but on the clean needle we can. Checks around the table. So we'll go ahead and get the air bubble out of this. We have it at 16. Now you're a nurse, right? So I'm gonna have you just look.
Hey, I'm Bob, the
verify how
nurse.
much I have, Bob, the nurse.
Hey, 16 units. Cool.
Perfect, right? Mr. Stevo, where was the last time you received your insulin? Where did you receive it last?
Up here on the left side.
On the left side, okay. So we're going to go ahead and give it on that far right side there. I don't know why your belly's hanging out so far over the edge. That's probably part of the reason why it's blood sugar.
Most likely.
Alright, pull your belly back here. I'm going to go ahead and clean the area. Tickles, doesn't it?
Cold.
Alright, we're going to go ahead. Gauge our safety. Alright, and then we'll cover your belly back up. Alright. Now we'll do our documentation. So we'll document how much insulin we gave. We gave it sub-Q in the right lower quadrant. Alright, Mr. Steve, one more pill and I'll let you get back to watching cartoons, okay?
Sounds good.
Alrighty. So the last one I have is your lisinopril, alright?
Mm-hmm.
Alright. So, can you do me a favor? Read me your ID number.
686-764-5607.
Alright, Mr. Stevo. We have your lisinopril here. We've gone ahead and confirmed it. We have 10 milligrams. The expiration date is 6/2018. And we'll confirm this barcode. And we got green on the first truck. How about that? Are you able to drink anything?
Yes.
Alright. I'm going to give you this little green gummy bear here to drink and a cup of water. There you go. And some water. Can you open your mouth and show me you took your pill? There you go. No cheeking. Alright, now we're going to go ahead and document this. You guys like to sell that with Cinepro. Alright. And we've gone ahead and documented it. So we went ahead, we checked all the orders. We've gone ahead and given everything that's green. Alrighty. Alright, sir, do you need anything else? I'm going to go ahead. Are you comfortable with your bed the way it is?
Mm-hmm.
Alright.
Agreed.
You need anything else before I leave?
Nope.
Alright.
Is that me?
So let's go ahead and get rid of our dirty gloves. We don't have trash cans here either at SPC Hospital. And we'll clean our hands. Yeah. So one more thing too. We gave you the insulin. Can you tell me anything about that? Do you know what you need to look out for with it?
I have to make sure that I move my sights and that I make sure I'm not too low before I give myself an
Good.
injection.
You also want to make sure you check your blood sugar after 30 minutes.
Okay.
And you need after 2 hours, but you want to make sure you eat within 30 minutes, right?
Yeah.
Also, I printed out some information for you here on your glucose monitoring and your diabetic ulcer.
Okay.
Right? I want you to go ahead and just sign here. This says that I gave you this, and that. There you go. And you drew a smiley face. Awesome. Okay, that counts. I'm going to leave this with you. If you have any questions, let me give you your fake call light here. Because we don't actually have call lights here.
Thank you.
Just yell.
Just yell really loud. My name is Matt. If you need anyone, Nate's going to be the tech. That'll help with you. Yeah. Alright? Alright, and we're going to wash our hands again.
I have a couple questions to ask you. We're outside the room, away from the patient smell. Were there any pertinent pieces of information you reviewed before administering the client this medication that you gave?
So, we went ahead and we looked at, for the insulin, we looked at his blood sugar. He had a blood sugar of 290. We went ahead, we checked to make sure that he doesn't have any history of allergic reaction to it. I had already looked in the chart to see where it was given last, and it was given in the left upper quadrant. I was just making sure Mr. Stevo knew about rotating his injection sites. Mr. Stevo, don't play with that IV. It's going to fall out. Thank you. He likes to play with the IV. For the lisinopril, we went ahead, I checked his allergies, made sure that he didn't have any history of allergies. We went ahead, I also checked his BUN and his creatinine to make sure that them kidneys are functioning pretty good. Also, for his Vanco, you know, we monitor his them kidneys too. So, Mr. Estivo, really, I'm trying to have a conversation here. Sorry about that. We were just trying to get he's trying to kick the camera off the nightstand.
Patience.
So he's never had an allergic reaction to penicillin and never had an allergic reaction to vancomycin either. So.
All right. Did any of this information affect your decision to administer the medication?
So the insulin is going to be dependent on his blood sugar. We need to make sure that his blood sugar is elevated enough to give insulin, and we need to make sure that it fits to the sliding scale. We also wanted to make sure that his IV was patent. If his IV was patent, obviously he can't get any of the IV medication.
And did any of that information affect how you administer the medication?
The orders are for his IV infusions to be given IV. They're also given at a certain time, so that dictates why we gave them. The lisinopril, nothing affected it, nothing prevented us from giving it. And the insulin, like I said, we followed the sliding scale.
Okay. Well, I think that's all of it. I really appreciate everything you told me and taught me about the patient. I think you did a fantastic job today.
All right, good. I'm going to go find out where Mr. Recibo's food is because he's pretty hungry. So.
All right. Bye-bye.